Hi, and welcome back to Community Hotline. I'm Monica Weitzel. We're here in Gresham at MetroEast Community Media. And now we're going to be talking with the City of Gresham, with the Gresham Fire and Emergency Services Department. Representing that department is Todd Keefley, the Division Chief of Emergency Operations. Thanks for being here.
Thank you. Thanks for having us.
Yeah, you bet. So, City of Gresham has obviously a lot of stuff going on.
Yeah.
The Fire and Emergency Services is one of those essential services everybody needs. And I know you obviously put out fires and you save lives, but you do a lot of other things too. Yeah. Tell me a little bit about what your service area is for fire and emergency services, and what are some of the other things you do?
Yeah, sure. Right now we have a contract with Wood Village, Fairview, and Troutdale, and then also we cover a portion of unincorporated Multnomah County, which is District 10, in addition to the city of Gresham.
Is that like down the Rockwood area, where there's that area that's kind of confusing as to whose area it is?
Yeah, there's been some confusion, but yeah, we go as we're over in the Halsey area, 190, one station over 194th and Halsey. Okay. That's considered Fairview. I have a station out in Troutdale, Station 75. So yeah, we're all over. The Station 76 was out on Dodge Park Boulevard. That's a District 10 station. So really 6 stations, but covering a lot of different areas.
Yeah, you do.
As far as what we do, you know, the list keeps expanding. It was fire and medical, and then hazardous materials was very popular for an extended period of time, and still is. Not popular, but necessary.
Yeah.
Swift water, you have the Sandy River that goes through some of our area, so being able to respond to the water and rescues involving the water.
So that's your job, that's not the county sheriff's?
No. You know, the county's been involved with the Columbia and Willamette, but as far as the Sandy River goes, I think there's some cooperation from them. But as far as we have a boat and we're able to respond and deal with some of those issues out there, you've got you know, everything. You know, we've had the Reynolds shooting, unfortunately. You know, when I started my career, if you told me we were going to be dealing with an active shooter, well, people.
That's the police. That's
that's the police. Yeah. So you know, and unfortunately, we've had to spend quite a bit of time learning how to deal with that.
Yeah, I bet the training for that kind of thing is got to be extensive.
Well, and it's not only do you want to perform well, you want to make sure that you come home at the end of the day. So you want to make sure that you're getting to the patients as quickly as you can, as safely as you can. You want to leave situations like that and know you did your very best. So you have the terrorism issues, you know, and it just, again, the list goes on, and we've got wonderful people that are doing their best to stay up on it, but I know that where we are today and the services that we're responsible for today is immense compared to when I came in 27 years ago.
Wow, yeah, I bet. What kinds of things do you do in a situation like the shooting? Is it a medical? Is that your focus?
Yeah, it's medical, and what we've learned, you know, again, unfortunately, we've learned by looking at other situations, whether it be Columbine. You know, if you look at the response that you would get today as opposed to Columbine, it would be significantly better. You know, Gresham had the Reynolds shooting, and police and fire did an outstanding job. I was not a part of Gresham at that point in time. I listened to it on the radio. I was in Portland, yeah. As a deputy chief, I listened to the incident, and I have to tell you, I was thoroughly impressed with the job that they did.
They did a fantastic job. They
police
really did.
And fire both. And, you know, it's really about, it used to be you had police and fire, and we would work together sometimes. We're working more closely today than ever before because we have to. They're going to get us into a safe location inside the school. We're there to provide care. They're going to try and eliminate the threat, if you will, and then we want to get those patients packaged and on their way to the hospital as quickly as possible.
And this isn't something I was planning on asking, but what does it take to become, you know, to work for the fire department in a job like yours? What kind of training do you have to go through, and what are the requirements?
You know, you can go to a community college, Chemeketa Community College, Portland Community College. I think there's a community college in Bend. They have what's referred to as a fire science program. That's a 2-year program. As far as the training, a lot of people become volunteers. They get involved in Explorer programs, which Gresham has an Explorer program, and I can't remember the age groups, but I think up until 18 years of age. You know, some people choose to do the volunteer route, and Sandy or Boring, some of these other outlying places have volunteers. Gresham does not. So they get their, I guess, their feet wet with that. There's intern programs. I was an intern with the city of Lake Oswego, so I was going to school to get a fire science degree and at the same time working as an intern. You know, there's a physical component.
Right.
There's a medical or a mental component of being able to remain calm. But I think the biggest part of it is being able to be part of a team. You're only, you know, an engine company in Gresham has 3 people on it, and you're only as good as those 3 people. And it's how well you fit together as a team. It's how well your organization fits together. You know, you have different people with different skill sets, and you have to utilize those skill sets to be as good as you possibly can be.
And you probably have to trust each other and really rely on each other a lot.
A lot of trust, yeah. And, you know, again, work with wonderful people that, you know, take the job very seriously. And again, there's a sense of pride when you pull away from an incident. You want to know that you did your best. Yeah. You want to know that you know, that we provided the appropriate care, or that we put the fire out as quickly as we can. So there's a sense of pride and unity and teamwork that goes along with the job, which is wonderful.
That's great.
Yeah.
So there's some new things that you're doing, and the city has been putting out some press releases on it, and one of them was something called a Pulse Point app.
Yeah.
Can you tell me what that's about?
Sure. Pulse Point is an app that works in conjunction with our computer-aided dispatch system, our 911 system.
Okay.
And it is a method for notifying bystanders. It's a method for notifying emergency responders that are off duty. But for example, one of the first saves that they recorded was a save that took place in Portland, Oregon. A truck driver was at the gym, walked out into the parking lot, and collapsed of a sudden cardiac event.
Okay.
There was an individual inside working out. He had the Pulse Point app. What Pulse Point does is it sends a notification to mobile devices. So he got a Pulse Point notification on a cell phone that said there was a cardiac arrest. He realized it was in the parking lot. He went out, provided CPR, and the individual, and that was the first.
How did the app, I mean, how did they get the information that this happened to this gentleman?
It will tell you what you can select, what emergencies you want to be notified of.
So did somebody go by and see him down?
So they called 911. 911, because it involved cardiac arrest, sent out a Pulse Point app, so it gets...
So anybody that was in the area that maybe could help get there before...
Yep, quarter-mile radius. And so he realized he was notified, he was CPR trained, he went out and started CPR on the individual in the parking lot, and he lived. Another
That's
one,
pretty impressive.
Yeah, I was reading about a 10-month-old baby. An individual was a EMS provider, but he was working his second job as a mechanic, and he got notified, and it was nearby, and so he went over and did CPR on a 10-week-old.
10-week-old?
10-week-old.
10-week-old.
Yeah.
Wow.
So yeah.
And baby was okay?
Yes.
Yeah, don't tell me any bad ones.
It's interesting. Early bystander CPR plays a huge role in the survivability rate of people with sudden cardiac or sudden cardiac arrest. If you get early bystander CPR, you have a twice to 3 times the chance of survivability.
Wow.
So double or triple your survivability rate. So for every minute that you go pulseless, you decrease your survivability by 10%. So at the 10-minute mark, you're pretty much minimal chance of, which is why we try to get there within 4 to 6 minutes.
Right.
But
depending on all sorts of factors, it could be later. I know our staff just got CPR trained last year, and you know that was a big deal to be able to do that, and we'll be getting a defibrillator here.
Right.
But if there's a lot of people trained and they're around.
American Heart says that 57% of adults have received some form of CPR training, but only 11% have actually used CPR in a live situation where they've tried to revive someone. So I think we want to get both those numbers up.
And that's a great way to do it. So if you have a smartphone, you can download the app, then I assume?
Download the app.
And it's called Pulse Point?
Pulse Point, yeah. And what has to happen is your fire agency or EMS provider in the area has to authorize it, and Gresham has done that.
So you can prove that you've taken the CPR class? Or
No,
what,
it just allows PulsePoint to integrate with our 911 system. So
Okay.
we allow that to happen.
Okay.
We say we think that there's value to have this program, this app, and we authorize it. The city of Gresham did, and so yeah. So now we'll be sending out notifications to bystanders. You know, the other thing you have to think about is how many nurses and doctors and firefighters and police officers and medically trained people you have around you all the time.
EMTs, yeah,
All over. So yeah, it's just a great way to reach out to them, and they can get the app, the notification. And in addition to PulsePoint, you have PulsePoint AED, which is a defibrillator that you referred to. Many of your businesses and public buildings are now have those defibrillators in them.
Which
so
we're going to. So if something
Yes.
happened out on
Yes.
the corner or
Yes.
something, then
we'll be notified that there's someone in sudden cardiac arrest. And sudden cardiac arrest is the #1 killer in this country, 1,000 people a day, and it is a
Wow.
malfunction of the electrical system of the heart. So what it needs defibrillation. It's literally rebooting the computer is what we're doing. So we will be able to see that there is a monitor or an AED nearby. We can go retrieve it, put it on the patient with very little training, and shock them.
that's
So
great.
it's great
It's
stuff.
good. It is
great
good stuff.
Yeah.
So anybody could get the app on their
Yes,
phone,
yes.
but would you get the app if you didn't have any kind of training? I mean, you would. It's the people that have the training that should get it, right?
Correct. And there
But
has
if you
been
don't, go out and get the training, right?
Right. Well, and there has been some concerns. Would we have a lot of bystanders coming to an emergency? I think most people that have it are really wanting it for notification reasons and wanting it to, again, you know, you're in Home Depot and you get a notification and somebody two aisles over is not breathing.
If you can save a life, I mean, that's life-changing right there.
Absolutely.
Yeah, it would be wonderful. Something else that you're doing is a quick response vehicle. Tell me about that.
Yeah, the quick response vehicle is a 2-person vehicle that was implemented into the city about the same time I came on 3 months ago. And what it is a 2-person ALS, Advanced Life Support truck, if you will.
Okay.
And they are on from 7 to 5 Monday through Thursday during our peak activity times. So during the day is the time that we have the largest number of runs. It's at the time when we're trying to train. We're doing pre-fires, we're doing physical fitness, we're trying to maintain our apparatus. And those things tend to take our companies out of service. So if your apparatus is down to be maintained, you're out of service. And where it gets difficult, we had just over 16,000 runs last year. We had a 10% increase.
Wow.
We've historically had a 5% increase. Last year was 10. We're struggling to meet the demands, but that's if everybody's in their fire station. Now imagine if the fire station in your area is on another call. So now you're depending on the other companies, other fire stations further
they're
away.
Available and,
Correct.
Yeah.
So what the QRV is doing is monitoring the resources in the city, and if for example, Engine 75 in Troutdale gets a call, they will then fade over into their area, and they won't go into that area, but they'll kind of hover on the line so that if there's another call in that area, they can respond to it.
Or they can also get over here if they need to.
They can also get over here too. And we try to keep them in the core area because that's where the predominance of our calls are. But it's working out very well. It's a very fiscally responsible thing to do. You know, instead of another 3-person engine company, we're trying some different things.
Yeah.
Again, the service delivery is we keep increasing in our numbers, and part of those runs, a good portion of them, are what are referred to as non-emergent, which are calls that are not of a critical nature.
They're not life or death.
They're not life or death.
Okay.
And so we hate to take a fire engine out of service to go. And I want to be real clear that, you know, people are calling out of need. It's not that they're abusing the system. There's tremendous public need today, more so than ever before. And so, you know, we're really looking at the services that we provide and saying, okay, we might have to look at things and do things differently.
Well, and you're obviously already doing things differently than you did 20 years ago. So
the other thing that's nice about the QRV is because they're in they're floating around the city, so when a call comes in, they can immediately go. They're ready. They're ready. They're already in their vehicle, as opposed to a 60 seconds to get people down to the engine and out the door.
So make a lot of difference.
They're getting there in less than 5 minutes, 83% of the time.
Wow, that's pretty impressive.
Yeah.
We're actually just about out of time.
Okay.
And I just want to know. I know you have some other things I would love to hear about, but tell me. You are from Gresham. originally, right?
Yes, yep, born and raised.
And you have come back. So
Yeah.
is it nice being back here?
I love it.
Working here?
I love it. It's yes, yeah. And it's a department that's of a size that you can identify changes and you can make changes. I've been thoroughly impressed. I've been here for 3 months as their division chief of emergency operations. Great people, great chief, and Greg Matthews, dedicated people. Yeah, and I've just again, I'm born and raised here, raised my family here, and it's great to be back.
And speaking of your family, don't you mentioned that you have a son that's kind
Yes,
of going into this same line
profession.
of work.
Yeah,
you must be proud.
I am.
Yeah. Well, thank you so much for being here, and thanks for
Thank you
sharing
very
that with
much.
us.
Yes.
And we're glad to have you back here in Gresham.
Thank you.
You bet. Thanks so much for watching this segment of Community Hotline. I hope you learned something. I know I did. And show some respect for those firefighters because they're doing a terrific job here. Don't go away. We'll be right back with some students from Park Rose High School.
What local community media is to us is literally our lifeline to what's going on in the lives around us.
The absolute most important thing that happens in your neighborhood.
People's local communities are usually what's most important to them.
Because we're the faces, the smiles, the peoples, and the personalities of the community.
To not only give people a voice, but to have their voice heard.